Welcome to Let's Thrive Postpartum, where we tackle postpartum depression and anxiety head on, guiding you back to yourself. Join Kelly Siebold, founder of Thrive Postpartum, and Ashley Moore, a maternal mental health therapist. Through honesty and laughter, we share expert advice and real stories. While not therapy or medical advice, you'll find education, support, and hope. Welcome to the village. Let's thrive postpartum.
Welcome back to Let's Thrive Postpartum. I'm Kelly.
I'm Ashley.
And today we are so excited to talk to you about the midwife's secrets for a better birth. And we are honored and thrilled to introduce you to our guest today. You have probably heard her on a previous podcast, Sara Holt. A midwife with over 25 years of experience, Sara has supported more than 3,500 births and is dedicated to empowering families through patient-led decisions and informed consent. She leads Byenveni Baby, offering unique programs to fill gaps in maternal care and promote autonomy in birth. She is also a Thrive expert and the creator of the Thrive course, a midwife's guide to avoiding cesarean births, available for purchase at wethrivepostpartum.com. Sara, welcome today. We are so excited to talk with you.
Thank you so much for having me again. And I am so excited to share this content with you guys because it is so, so, so important. And obviously it's my passion. And I just want to thank you again for having me. So excited to be here.
Yeah. I know. And yeah, I can't wait to hear everything that you have to share. And I think, Sara, if you just want to dive right in, you also had an article that came out recently. I think that kind of covered this topic, which we'll link in the show notes.
Great.
But where would you like to begin? What are some of the midwife secrets?
Well, I think the first thing I want to talk about is probably doesn't sound like a secret, but it's something that we've really moved away from recently, which is spontaneous labor and physiologic birth. So over my career, I've really seen this big drift towards medicalization of birth. And I'm sure people that are kind of reading more about birth and the climate of birth are reading more about this. But it's unfortunate. We have generations of new providers and especially physicians who have been taught in this very intervention-based model. And many times you'll hear patients or clients say like, I was really tired of being pregnant and my provider said, hey, there's this study that says like it's completely fine just to induce your labor maybe at 39 weeks or 40 weeks. But that study has been met with a lot of criticism recently. And I do have a lot of information in the article that you're going to link about the studies since that. But what I want to talk about really is just the beautiful protection that your body has within you to support a really healthy birth. So in the days prior to going into labor, we have these hormonal systems that interplay between the maternal or the birthing person and the fetus. So you have upregulation in your uterus of these oxytocin receptors that kind of turn on your uterus and make it more receptive to your natural oxytocin. You also have fetal catecholamine receptors in the brain that protect the baby from hypoxic or low oxygen episodes during labor. So when you go into labor on your own, you have a more effective labor. Your contractions are more powerful, but they're less likely to cause fetal intolerance or fetal stress. You have more likelihood of having a shorter, more productive labor with less risk of postpartum hemorrhage. And we know that your natural body-given oxytocin crosses the blood-brain barrier and releases endorphins, which are your body's natural painkillers. So your labor is actually less painful. So when you see videos on, YouTube or TikTok or Instagram of people laboring at home and they're like very calm and they're in a tub, or they're doing these things, and you think like, what is the deal there? They are, by and large, first, they're in their own environment. They don't have the big fight or flight, fear, freeze, hormones of being in a hospital surrounded by people they don't know under bright lights with artificial hormones. They have these lovely endorphins and natural painkillers on board as well. So obviously, if there's a medical indication or there's a safety reason that you need to have an induction of labor, for sure, you should do that. But if you do not have a reason, you really should allow your body to go into labor on its own. And it's important to understand and normalize that a lot of times babies come after the due date. And that's something that I talk to my clients about from the very first visit. First babies come typically about 5 to 8 days late. The second babies a few days earlier than that. So just being prepared for that, knowing that that's really okay. That's typical, that's normal, and to kind of settle in for that and set that expectation, and just to try to be available and to understand that, you have within you this beautiful system that can protect you and protect your baby. And trying to get back to understanding that is really, really important.
I love that. And I think this is probably actually going to maybe transition into one of the second points when it comes to midwifery care. But I feel like so much of this is based in education, right? Like while you're pregnant, for women to get all like really good information about what the body is going through, what the birthing process looks like, what it feels like, what to expect, because that fear piece, I think, is what is really hard for people, and that fear of the unknown. And I mean, we all know when you're scared and you tense up, like that's going to make everything so much more painful. And so I think the education piece is so important, but people now with so many resources and like information out there, how do people get good, reliable, like educational information?
Right. It's very difficult. And I think I would like to add some really great resources too to the reading list, because you can go on the internet and you can look up, one question, and you can find one answer over here, and then you can find the exact opposite answer, and you can find people that are entrenched in both of those. But I think, one example of this is this hot button question that I get all the time, which I just feel so bad, because I feel like in our country, we have really taken this step that has really infantilized women and birthing people. And, I always want to say somehow we got to this point in our lives where we, are career people, we have, created lives for ourselves, and then we become pregnant, and all of a sudden we are told what to do, what to eat, how to sleep, all these things. And it's really this very different position for people to be in. So people ask me all the time, or they'll call and say, I woke up and I was on my back. Is everything okay? So this is an example of something that has just gone way too far. Your body has protections in place. The majority of people can sleep on their back and everything is fine. There was a study, and it was probably in the late 80s or early 90s, from Parkland Hospital I think it's in Dallas. Yeah, it's in Dallas. So they got a bunch of pregnant people and they inserted these Swan-Ganz catheters, and they measured cardiac output in all different positions. So cardiac output was slightly better when women laid on their back. I'm sorry, on their left side, of course. And there is concern about aortic compression when you lay on your back, right? So people think I must lay on my left side because cardiac output could be better. Okay, it was statistically significant. That does not translate into clinically significant, right? So there's no data that says your baby is smarter, bigger, anything like that. If you lay on your back and you feel fine, you are fine. Our bodies are intelligent. So if you lay on your back and there is a problem, you will feel sick. You feel like you have to throw up. you move. You will not hurt yourself or your baby. You will not be cluelessly passing your time somewhere and be hurting yourself. I mean, if something is happening to you, you feel pain, right? Our bodies signal us. So we have to get back into understanding that our bodies protect us in all things and pregnancy as well.
And trusting and listening to your body, right? I think a lot of people, because during pregnancy right now, you're told you need to do this and do that and don't do this, and don't do that. People start ignoring certain things that could be signs or aren't signs, right? Like we create problems that aren't there. And then we sometimes can ignore problems because we are so focused on only doing what something says. So I was one of those people you notice with my second when I would be on my back. Yeah, I didn't feel good. And so I was like, I'm going to roll over.
Right, exactly. There you go. Yeah, I'm getting a sign here. I'll do something different. I could sleep on my back the whole time. And I did. I mean, I would snore because of all that pregnancy congestion, but I was quite happy and slept well. Maybe my partner wasn't because I was snoring, but I was sleeping well, and that was important at that phase, right? Yeah.
So do you feel like under midwife care, like, is there more of this education component? Like, what does that look like as part of this whole process?
Yeah, so that's also something that I wanted to talk about with kind of one of the secrets is midwifery care. So, midwifery care is more, it has a nursing background typically. So, a lot of people don't know what nurse midwives are. And I actually did not know what a nurse midwife was before I started my journey. I was a nurse first and went to a really big high risk facility in the Pacific and learned so much about everything that could go wrong in pregnancy. And then pretty quickly realized, like, well, all these people that everything is fine, we're just like acting like it's a 911 emergency 5 alarm fire. Like, why can't we just let them do their thing? Because everything's working well. Why is everyone getting an episiotomy and all of these things that really aren't necessary? So, my mom was like, "You should be a midwife." And I was like, "I don't know what that is?" So she's like, "It's a nurse practitioner. It's a real deal." And I was like, "Oh, okay." So I decided, I'll give that a shot. And, the rest is history. And it's amazing. But so people don't know what that is. But midwifery has a long and rich history in the United States up until about the 1900s when doctors decided that midwives, who were by and large a lot of Black midwives who had been brought over, unfortunately, during the slave period from Africa and had this long, passed down history of this wise tradition of caring for people throughout history. Women have always attended women at birth. Midwives have a really strong record of safety. The background is more of a holistic, family centered care. Some of the hallmarks of care are, relationship, shared decision making. We believe that, no one has a bigger stake in the relationship on outcome than the woman and birthing person and their family. So, decisions should really kind of be focused on being made by the person who has the biggest, who's the biggest stakeholder in the outcome. So the majority of midwives practice in hospitals. In the state of Oregon, where I live and practice, last year, 27% of births were attended by midwives. 25% of those were hospital-based, and about 2% are community and home birth. Nationally, I think it's about 10 to 12% of births are attended by midwives. But we know that if you are having your first baby, your chance of having a C-section is about 30% less if you are under midwifery care and 40% less for your second baby. So it's pretty powerful. The Commonwealth Group is an international agency that measures health systems for the high income countries. It's an international agency. And so they did another review of maternal mortality. Of course, that's all in the news recently. And this was in, I believe, 2020, which was prior to our maternal mortality statistics getting that much worse. And the US is always at the bottom of outcomes. And their finding was that midwives were way underrepresented compared to other high income countries. And that was part of the issue. So for comparison, I think the stats were something like we have like 6 midwives to I'm sorry, I can't remember right now, but something like 25 OBs or something like that. And in other countries, it'll be 50 midwives to 6 OBs or something like that. There's also a study called MISS, or the Midwifery Integration Scoring System for the US, that shows in areas where there are not midwifery services available, it shows the outcomes are much more dire for people, and particularly for people of color. And you can go on those sites too and see how that looks. So it's a really powerful method of care. People think, oh, if I have a midwife, I can't get an epidural, or they think that they have biases against pain medication or things like that, but that's not accurate.
And lots of hospital systems have them integrate. I mean, GW Hospital in DC, where I gave birth with my second, they have a side-by-side parallel midwife clinic and OB clinic, and they kind of go back and forth, and it was an option all within the same, literally the same office. And I think that there's options like that too. And lots of
that's what I was going to ask, because I was one of the people, Sarah, who did not know what midwifery was. And now you mentioned a lot of women don't. So if someone is going through all the stats and the increased outcomes, if somebody is looking fit for a support from a midwife, how do you recommend they find one? Is it just searching hospitals? How do they get connected with a local midwife?
Yeah, so there are ways to find midwives. The American College of Nurse Midwives has a midwife finder search option. Also, Leapfrog, hospitalratings.org rates hospitals. And I would recommend that people, when they start looking at where do I want to give birth, they look at those hospitals. They keep stats for every hospital, including C-section rates, episiotomy rates. And what that shows you is the culture at that hospital. And their indicators of quality are access to nurse midwives, C-section rates, episiotomy rates, things like, are people getting protection from blood clots after surgery, things like that. So I have a family member who is just kind of newly pregnant in the Bay Area. I don't know if they want me to announce who they are yet, but and they are trying to find midwifery care. And they've had a hard time. They don't have Kaiser. So we're looking at trying to find a midwife, and all the midwives are through the Kaiser system. And so now I'm sort of like, yeah, oh, well, can you switch to Kaiser? Because it looks like they've gotten all the midwives there. And we looked at the Kaiser facilities. I don't know if I should be saying Kaiser, promoting that, but the statistics on the hospital that she was thinking was close to her that she wanted to give birth at, they have almost a 10% episiotomy rate, where episiotomy is no longer an evidence-based practice. It's only used in cases of fetal distress. You can't tell me that 10% of babies at that hospital have fetal distress at the time they're being born. So the other facility, which is Kaiser, okay, I said it, their rate was less than 1%. And so it's like, wow, that shows you the culture and shows you that they're following evidence-based practices. And that probably does not only apply to that one, marker. So you really want to find hospitals that have a culture of following best practices. And best practice includes midwifery care. The hospital that I'm practicing at too, we have collaborative care. So basically, all of the patients are attended by nurse midwives. We have physicians that are on call and available, but they typically are not involved unless we call them and, consult with them. And that's everyone's working to their scope.
Well, I think that goes back to like asking questions, right? Just asking questions and trying to figure out what's important to you and knowing that there is so much information out there. There's so many different, there's hospitals and insurance and everything's different. And moms need to be advocating for themselves and learning what questions they need to ask so that they have the best chance at the outcome they want.
Right. And understanding what is the most important for you. So my family member is like, well, I really don't want an induction. I'm hoping for unmedicated birth. And, they've already hired a doula. And so I said, you need to be in the place where those things are kind of given, I said, you don't want to go to you wouldn't want to go to a vegetarian restaurant and say can you just make me a steak? I know you're not used to doing that. And then you hope that the outcome is okay. That may not go well for you. You may not end up with an ideal situation, so she's like, yeah, that's a good point.
That's a great analogy. And so we will include that link in the show notes that Sara referenced for looking at hospitals. So Sara, we've gone through 2 secrets: spontaneous labor and midwifery care. What else do you recommend?
Okay, we did just mention it, but doula care. Yes. So doulas are birth professionals who you typically would meet a couple times before your birth. And they are sort of an advocate. They are someone who is versed in all the things. A lot of times they have experience either with massage techniques or programs. There's a program called Spinning Babies, which is positioning techniques. So perhaps you're going to get an epidural, but they help with positioning and movement and things like that can help with fetal rotation and things. They're also, if you want unmedicated birth, they're really great at getting in there and helping you and coaching you. They're great to help your partner through. Not every partner is going to want to be that absolute labor coach. Labor can be really long. A lot of times a family needs support as well. Having that person that your provider, even if you are very bonded with them, they may not be there, right? They are in a call rotation. Typically, you do not know your nurse when you go in. So having that person who is there is calming. It helps reduce your stress hormones. That will, make for a better labor progression. There was a really old study, and I think it was in Central America, and it was, very powerful numbers. I can't remember if it was 20,000 people, but it was probably in the 60s or 70s. And this is back when partners were not allowed to be in labor. And so people came in and they were put into 3 groups. And one group was they just were in the labor room alone, basically. They had a nurse that came and did the nursing tasks. The other group was they had one person in the room with them. They sat there. They didn't really talk to them or anything like that, but they had the companionship of another person. And then the third group was a person that was with them and talked with them. So outcomes were specifically better based on the person who had someone that talked to them. The person that was the best outcome. The next best was someone just being with them. And the worst was someone that was alone. I mean, it's the power of you guys talk about all the time, community, being with, right? All of those things that are so important. We are, social people. We get power from others, right? So it's really important. So we have, programs in place, a lot of state programs who are caring for people at the margins or, people who are, in, lower income situations have programs for people to get free doulas, labor doulas. We have a great program for people of color here in Portland who get labor doulas and lactation that's culturally congruent and postpartum doulas. So we know the power of this care. So we want people on the margins and people who, could be at disadvantages to get that care. But honestly, everyone should get that care because we know how important it is. So there was a pediatrician, John Kennel, I think was his name, and he said that if doula was a drug, it would be unethical not to use it.
So I feel like I've missed every single thing that you've recommended. I did wrong from the get-go. This is number 3 that I didn't have. We've got
it's all a big secret. I don't understand why.
I have met, since we've started this podcast and Thrive, I have met the most amazing doulas that if you are pregnant, consider looking this way. I believe Jonah International is an organization.
Yes.
You can go in and you can search, you can find doulas in your areas or doula programs. There's such another great resource that as a mom, I just did not know was something that was in my backyard and right here.
Yes.
And available.
Yes. I don't understand. Why is this all a secret? We need these things.
We do.
Yes.
So Sarah, spontaneous labor, midwifery care, doula care, any other secrets that you have for a better birth?
Okay. Are you ready? Because this is a big one.
If I already didn't know the other 3, I can't wait to hear this.
Okay. This is a huge one. This is used widely in the UK and in Australia for pain relief. It is a huge secret. And I'm really on a mission to bring it over here. It's the TENS machine for labor. Okay. Can you see this?
It is holding up a machine for us right now. It kind of looks like a stethoscope almost with sticky pads.
Can you spell it for people?
TENS. Okay. Transcutaneous electrical nerve stimulation. So people who have been in physical therapy or who have had injuries have perhaps used this. So it is, let me show you how it is applied for labor. If you can you see that?
Like some sticky pads that go, you can put it on it looks like largely on your back, mid and lower back.
Yes.
And they do look like big gauze sticky pads.
Yeah.
Yes. So this is a machine, a TENS machine that is specifically designed for labor. We have a rental program here at Byenveni, and I do send them all over the country. It is research-based. It has been shown to have a great reduction in pain scores. There was a recent study that showed actually a shorter labor when people are using this first stage of labor. So that's the contraction before you get to pushing, from release of endorphins. So this stimulates the nerves along the spinal cord and overwhelms your brain so that the pain fibers do not reach your brain in the same way. So there are 15 levels of intensity. There's a contraction boost that changes the intensity and the pattern. There are a few different patterns. So it is a very powerful tool. It's best used when you start using it on a lower intensity in labor and you bring it up as needed. And it's just a great research-based tool. You can use it if you're hoping for unmedicated birth. You can use it if you want to just delay getting more pain relief. You can't use it in water, of course, but it is a fantastic and underutilized thing. The machines come from the UK, but they are a fantastic tool. And I am on a mission for people to start using this more.
So I've used, and a lot of people might have seen these little TENS machines at CVS. They're these little patches you can put on your shoulder and your back, your hip, lower back for like muscle pain and nerve pain if you have a slip disc and that kind of thing. But I had no idea that they had one developed specifically for labor.
Specifically for labor.
Makes sense.
Yes.
What does it feel like?
It just feels like, pins and needles kind of.
Okay.
Yeah.
Not a comfort. I mean, it's not like it doesn't feel good, right? It's not like
Right.
necessarily you want to use it as a massage technique or anything like that.
Right.
But yeah, for like the muscle ones, it like does this kind of, it tenses up your muscle and releases it, and it tenses it up and then releases. And yeah, during labor, I can completely see. I mean, the most basic analogy I'm thinking is like, when the doctor would, as a kid, would go to give you a shot and you would kind of yourself a little bit to make the shot not hurt as bad because your brain is then receiving other information rather than just the pain from like the shot.
Also, people pop them on the uterus like after pain.
It helps to, okay.
Mhm. It's fantastic. And I've gotten such good feedback from the people that have used them. I had someone who used them first baby for an induction and had an unmedicated. She was late term, so she was like, her body was primed. She had an induction. She had a pretty quick induction. But she said I ended up having to take it off when I was pushing because I couldn't really feel my contraction. I was like, what?
Who can't feel their contractions? I mean, right there is a sticking point. We were
I
saying
know.
that's amazing.
Yeah.
That's amazing. I wish I'd had
Yeah.
it with my daughter. Not that I would have had
Yeah.
time to put it on because she was born so fast.
Oh, yeah. So
That's
really
a
powerful
wonderful
stuff.
resource. Yeah, that's
Yeah.
amazing.
We'd love to check the show notes. We'll include the link to information about the tins and where you can rent that if you're interested and learn more, because that is another huge secret that, again, 0 for 4 that I'm batting coming into of secrets that I should have known.
I don't want these things to be secret anymore. Let's get them out there. Yeah.
Do and help women have better birth outcomes.
Yeah, absolutely. It's so important. How we birth affects how we do postpartum, right?
Mhm.
And you want to step into your postpartum time feeling confident, feeling powerful, right? Feeling not traumatized, feeling capable. So this stuff is very important.
Sarah, thank you. Are there any last minute secrets or anything that you would want a pregnant mother to know going into birth that we haven't asked about or talked about yet?
I think just remember always that you have this inside of you, right? A lot of times when people are getting close to the end and they're feeling frantic, I always say, like, if we did nothing in, 2 weeks, 3 weeks, you would be sitting in front of me with a baby in your arms. You have what it takes to do this. Is there anything that you were put here to do more than this? Right? It's actually inside of you. And we just have to let it happen. But it's very difficult. I mean, I don't want to trivialize it. It's very difficult. We're used to, when we're going to do something hard, we're used to, being able to study for it and feeling like, yeah, I've got a competency. I've worked really hard. I can, I feel pretty good going into that exam or whatever. And this is totally different, but, lean into your understanding that, you were designed for this.
It's wonderful. Sarah, thank you so much.
Thank you. Yeah, it's my pleasure.
And thank you all for listening. Hopefully these 4 tips have been really impactful. I know I learned a lot, and before we wrap up, Sarah, how can people find you and get in touch with you? We'll include some stuff in the show notes, but please tell us more.
Yeah, so you can go to byenvenibaby.com or follow on Instagram at Byenveni Baby, and I would be happy to chat at any time with anyone or hook you up with a TENS. Yeah, this is my passion, and it's just really important. So I'm here to help. And thanks so much again for having me. You guys are amazing.
Of course. Well, thank you, and we will see you moms next week.
If you enjoyed this episode and found it helpful, please be sure to hit subscribe, leave us your feedback, and give us a 5-star review. For even more support, visit us at wethrivepostpartum.com midwifery.com/podcast to sign up for our newsletter and learn more about our community. Remember, you are not alone. With support, you can feel better. Together, let's thrive postpartum.